Good evening. Good evening, everybody, once again. Good evening, Professor Ola. Good evening, Dr. Kunle. It's a pleasure to have you here once again. We are all welcome to the day two of the event, Clinical Practice in Tough Terrains. So I'd like to appreciate and recognize the presence of everyone here. Thank you so much for making it in and on time as well. You're welcome. I believe for me it's been a splendid moment gleaning so much from people had who have had the experience of practicing veterinary medicine in across different fields in Nigeria. So it's a pleasure to be here for me, and I believe it's the same for several of us here. I would like to recognize the presence of Dr. Kunle. You're welcome, sir. Thank you so much for joining in. I also like to recognize the presence of Dr. Mark Holmes. Thank you for joining in, sir. You're welcome. And to our speaker for today, Professor Adetola. You're welcome, sir.
Thank you.
Without further ado, I believe we'll begin immediately. Before we welcome the speaker for the day, I would like to read his citation. So Dr. Ajadi Rashid Adetola is a professor of veterinary surgery at the Federal University of Agriculture, Abeokuta, Ogun State, Nigeria. He obtained his Doctor of Veterinary Medicine degree with distinction in veterinary surgery from the University of Ibadan and completed his Doctor of Philosophy degree in veterinary surgery from Federal University of Agriculture, Abeokuta. The focus of his research as a veterinary surgeon has been broadly to understand the management of pain in surgical patients and the pathophysiology of pain in musculoskeletal diseases, with special focus on osteoarthritis. He is a consultant small animal surgeon at the Veterinary Teaching Hospital, Federal University of Agriculture, Abeokuta, and the current head of Department, Veterinary Surgery and Pyogeneology. Dr. Ajadi is a member of the Global Pain Council of the World Small Animal Veterinary Association, also a member of International Veterinary Radiology Association, Osteoarthritis Research Society International, Small Animal Veterinary Association of Nigeria, and Nigerian Veterinary Medical Association. Dr. Ajadi has authored over 90 publications in the area of veterinary anesthesia, veterinary surgery, osteoarthritis, and diagnostic imaging in both local and international journals. So let's make welcome Dr. Ajadi Rashid Adetola. You're welcome, sir. It's great to have you. It's a pleasure to have you here, sir. Please keep the
Thank
comments
you.
coming.
Thank you very much. Um, and I want to say a big thank you to Dr. Kunle Abiade and Dr. Mark Holmes for starting the discussion yesterday. The presentation yesterday was awesome, and actually they have laid a good foundation for my discussion this evening, if you're in Nigeria. This evening, I've been asked to talk about academic rigor meets real world practice. And I intend to use my story to deliver this lecture. So this evening, I just want you to relax and listen to my story. And I believe you're going to gain one thing or the other. I joined the veterinary school in 1991. At the time I entered the veterinary school, there was just one veterinary dedicated radiographic center in the whole of Nigeria. At that time, there was no veterinary dedicated ultrasound machine. There was no veterinary dedicated endoscopic machine. And probably the only anesthetic agent available apart from ketamine was xylazine and pentobarbital. And you're going to see how we have progressed from what it was when I was a student, when it looks as if things were bleak, and where we are now, almost about 30 years when I entered the veterinary school. This is probably the first case that I had to handle when I finished from the veterinary school. This is a 5-month-old Alsatian German Shepherd dog that was presented to Petcare Animal Hospital. I was a veterinary surgeon then, just finished from the veterinary school. And if you look closely at this dog, you're going to notice a swelling around the elbow joint, which was bilateral. At that time, like I told you, there was just one X-ray facility. A lot of the time we have to take dogs to human facilities. This dog came with history of fever, he had diarrhea, he had anorexia, and there was pain on all the limbs. Because of that, this dog was reluctant to move. Initially, we thought it's one of those viral infections because of the diarrhea and the vomition and the fever. And we took blood for blood work. But when we noticed this swelling, we also decided to take radiographs to know what exactly it was. And this radiograph shows radio-opaque periosteal reactions, both at the proximal and the distal metaphysis. At that time, our knowledge is limited, so we thought that this probably will be a case of osteosarcoma. And because of the bilateral nature of this, we felt that we could not help, so we decided to euthanize this dog. And after we euthanized the dog, we sent sample for histopathology, and histopathology at that time also confirmed that, yes, it was a case of osteosarcoma, but something told me, and this is part of the thing that Dr. Malcolm said, we have to continuously update our knowledge. Something inside of me told me that osteosarcoma is not supposed to be bilaterally symmetrical. So I started asking myself questions, looking for information. And at a point, I met with a consultant pathologist, human consultant pathologist, and I showed him the histopathologic features. And he told me this looks like hypovitamin C, or what they call scurvy in human being. So when I had that, I went online to check what is hypovitamin C in dogs. And I came with this word, hypertrophic osteodystrophy, canine hypertrophic osteodystrophy. And that was the first time that we come to understand canine hypertrophic osteodystrophy. Thereafter, we have been able to make about 3 or 4 diagnoses of this condition. This is a very rare condition in young dogs. Unfortunately, after knowing about this disease, I found that this is a self-limiting problem, that ideally we should not have euthanized the dog. Once the growth plate of this dog fuse, the problem will stop. It's a self-limiting metabolic bone disease in dogs. This is to reiterate the fact that as a veterinarian or a common veterinarian, you don't need to look down at yourself. We are going to make mistakes initially, but we are going to grow eventually. We are going to learn from our mistakes, and then we're going to become better. After graduation 27 years ago, I graduated with a distinction in veterinary surgery, and probably that was what prompted me to go into surgery. I joined the Department of Veterinary Surgery at the University of Ibadan in 2000, and I obtained my master's degree in veterinary surgery in 2003. In 2014, I obtained my master's in veterinary surgery in 2014, and then I became professor of veterinary surgery in 2020. Just to tell you, so no matter where you are today, as long as you are focused, as long as you are dedicated, and you have a dream, it is very sure that you're going to get to your dream. Yes, Dr. Abedi mentioned the fact that the opportunity in veterinary medicine, especially in the sub-Saharan Africa, is limited. But it's only limited to those that do not have a dream and do not have a focus. As long as you have a dream, you will see the vision of where to go to in veterinary medicine. In the last 27 years, I have operated over 3,000 animals of different species, including a lion. And I'm going to show some of the cases today. I've also anesthetized over 7,000 animals of different species. I've made over 5,000 radiographs of different species of animals. I performed over 2,000 ultrasound examinations. Today, I'm certified to take hip and elbow radiographs for the WSV, that is the German Shepherd Club in Germany, and also the KUSA, that's for the Kennel Union of South Africa. And here I'm showing you the lion that we operated. It was an 11-month-old lion, male lion, that was presented after he started vomiting. And what was the cause of the vomition? I think it was cold, and the keeper decided to put towel on the floor of the house, thinking that that will reduce the cold. A day after, they found out that the towel has disappeared and the lion was vomiting. So we decided to take abdominal radiographs of the lion, which I'm showing you, and it shows the presence of the radio-opaque linear foreign body. So because of that, we scheduled an laparogastrotomy. And after the laparotomy, we also found out that this lion had intussusception, which you can see here. And apart from the intussusception, the dog also has the gastric foreign body. So we perform a gastrotomy to remove the gastric foreign body, and we also reduce the intestinal, the duodenal intussusception. And I'm glad to tell you that the lion survived the surgery and is doing well. This is another case that we handle right here in Nigeria. It's a peacock that was presented following an injury to the leg. He had a diaphyseal and oblique diaphyseal tibiotarsal fracture, and we were able to fix in a bone plate. It was a modified bone plate because of the size of the dog. We used the human pediatric bone plate to fix the fracture. This is another puppy that was presented to us with a growth on the mouth, around the gum. Cytologic and histologic examination revealed that it was an ameloblastoma. So we did a radical resection of the tumor, followed with a chemotherapy, and this dog survived the condition. Here I'm showing you the ultrasound and the radiograph of a 6-year-old dog with chronic hematuria. And the radiograph revealed radio-opaque foreign body inside the bladder, which was confirmed also by ultrasound to be an hyperechoic structure within the bladder, which is indicative of cystic calculi. So based on that, we performed a cystotomy, a laparocystotomy, and we removed this massive calculi measuring almost about 4 centimeters in diameter. Let me have it all, yes. And I'm also showing you one of the very rare conditions that was presented to us. It was a Warble Beach, 4 years old. The owner presented it 2 weeks after an elective cesarean section was performed, because he noticed that the dog was not eating, and he also noticed a small abdominal distension. So we did an abdominal ultrasound, and we noticed the presence of a fetus outside of the uterus. So we performed an abdominal ultrasound. I mean, we performed a laparotomy again, and we removed a dead fetus somewhere close to the spleen. I decided to show you all these cases to let you know that no matter where you are in the practice, as you are dedicated and you're focused, you can achieve whatever dream you have for yourself in veterinary practice. But there are some things you need to have before this goal can be achieved. And the first thing I want to tell you is, do you have a dream? You must have a dream. You must have a very big dream if you're going to succeed as a veterinarian. I think Dr. Abiade mentioned that yesterday, that when he started, he had a dream of being the best, of having the best veterinary hospital in Nigeria. And I can assure you that today he has achieved that dream. The dream is alive and he has achieved this dream. So as a young graduate, as a student aspiring to be a vet, you need to have a dream. You need to dream. What do you intend to be in the next 5 years? In the next 10 years, what outlook do you have for yourself? Without a dream, you are not going to have a direction of how to move. And you need to define your dream. Your dream must be specific. Do you want to be a small animal practitioner? Do you want to be a large animal practitioner? What exactly do you want for your life? You need a dream. And please do not dream small. Do not allow the current circumstances to define your dream, because the truth is that you can achieve more than the current circumstances. Don't allow the current situation of the country, of where you are, to limit your dream. Dream big. And when you dream big, you are also going to achieve big. Once you have a dream, then the next thing is to improve yourself. You cannot rely only on the knowledge that you receive during your undergraduate years. That knowledge, we call it the minimum knowledge required to be a first-day veterinary surgeon. That is not all that you need. So you need to improve yourself daily. Unfortunately, your generation, you are lucky, because there are very good opportunities to improve yourself. The first way to improve yourself is to volunteer. As a young veterinary graduate, your first goal is not about money, how to make big money. If you want to be in practice, your first goal is to acquire knowledge, is to improve yourself. So the first thing to do is to volunteer. If you cannot get a job where you want to be, go there and ask them that you want to volunteer. You can volunteer for 1 month, you can volunteer for 3 months. One of the things that helped me was that as a student, I started volunteering at Petcare Animal Hospital. Any little opportunity that I have, any free period, I go to Petcare to volunteer. And that exposed me to a lot of cases. It exposed me to a lot of knowledge. So if you want to grow, you must volunteer. Look for a practice that looks like the one that you dream of and go there and volunteer your service. When you do that, you will learn. When you do that, you will understand. When you do that also, you will have the courage and the boldness to set out. Another way to improve yourself is to use the social media. That is one good thing about this current generation. We have a lot of information in the social media. YouTube, there are a lot of procedures in the YouTube that you can learn from. There are a lot of opportunities on LinkedIn. Even on Facebook, there are a lot of things that you can get. On Google, there are lots of information that you can get. And all these are available at our disposal. So please make use of your social media properly, because there is a lot of things you can learn, even without paying so much to learn them. And it's important for you to network. If you're going to grow, you cannot grow alone. you need to grow with people. So learn to network. The more you network, the more the opportunity you have, and the more you will grow as a veterinarian. And one of the things you also need to do is to identify what you need. If you started a practice, or you are not planning, or you are planning to have a practice, at the beginning, you cannot have all the equipment. You cannot have all the resources. But the resources are somewhere that you can share it by paying certain amount of money. In fact, even with that, you can make a lot of money. For instance, I told you when we started, there was no radiography facilities. I think for more than 20 years, pet care do not have a radiography facilities. What we do is to take our patients to human radiography facilities, and they take the X-ray for us. It improves the quality of service we are giving to our clients, and our clients are paying us for that. At the point in time, we do not have our own laboratory. We do not have our own laboratory services. What we do is to collect samples from our patients, and we send it to human laboratories. They analyze for us. And as we grow, we begin to invest in those facilities that we think we should have. So at the start, identify the things, the services that you need. And once you identify that, then also identify where you can make use of them, where you can share them. For instance, where can I send my sample to that I know they are reliable, they're going to give me results? Where can I do my radiographs? Where can I do my ultrasound? They will give me results, and then it can improve my, the services I'm giving to my patients as well as my clients. So you need to identify that, and then make use of them as you grow towards acquiring all these facilities that you think they are big. Malcolm said yesterday, veterinary medicine or excellent services is not all about equipment or facilities, but it's more about what you know. So as you grow in what you know, even when those facilities are not available, you can make use of them by identifying what you need and where you can make use of them. And like the two of them said yesterday, you need to have this determination that you want to provide excellent care. And excellent care is a care that solves the problem of your patient and then relieves the anxiety of your clients. So that desire must be there. The desire should not be about money. Yes, you are going to make money. Yes, I agree that money is important, but the money will come only when you have provided an excellent care. And let me say this, the money that you get from veterinary medicine is not just only about the money or the charges that your client pays you. One of the unseen money is also that your clients can recommend you to other people just because you have provided excellent care. Your clients can recommend you to opportunities just because you have provided excellent care to just one person. So it's your goal and your focus and desire should be that I am going to provide the best of care for every patient that come to me. I want to thank everyone for the opportunity given to me to address you. And I'm ready to take one or two questions if we have any. Thank you.
Thank you so much, Professor Ajadi Adetola Rashid, for this wonderful session. I was able to glean a lot. For me, I didn't even want the pictures to end because it was fascinating to see the gastrotomy that was done on the lion and several other procedures that you showed. Thank you so much for that. In the course of the meeting, we had some distinguished guests and practitioners come in. So I would like to recognize the presence of Dr. Kunle Abiade of Pet Care Hospital. He was the speaker for yesterday. And also Dr. Ibinkule Mark Akambi, who is an assistant chief veterinary. with over 19 years experience with the Ministry of Agriculture and Rural Development Secretariat Ibadan. Welcome, sirs. It's a pleasure to have you in our midst today.
Thank you very
Thank you
much.
very much.
So, without wasting much time, we'll give the floor to Dr. Mark Holmes, who is a veterinary practitioner in Scotland. Dr. Mark, you can have the floor now. You're welcome, sir.
Thank you.
Thank you.
I want to share my screen shortly. I very much enjoyed Dr. Ajadi's talk. I recognized the photos from surgeries I've done myself, maybe not on lions, but certainly from surgeries I've done on smaller feline patients and things. So it was very interesting. There we go. Right. Thank you. And thank you for listening to me again this evening. Last night we talked about what I felt clinical excellence meant, and I said yes, it can mean adherence to absolute clinical principles, but a certain amount of flexibility might be required in the situations where they might not be available, the facilities might not be available. I appreciate there are challenges within Nigeria, but I don't think that means that you can't have a mindset of clinical excellence, whatever your circumstances. If you're lucky enough to work in a clinic where these things are available, such as the pet care hospital, then that is a really good opportunity. But let's not be put off doing anything when something is often better than nothing. And as I say there, if all you can do is clean their wounds, then clean their wounds. Sometimes that is all you have available, but you can still do that. In the UK, we talk about gold standard. I don't know if that is a phrase that is a phrase that is familiar to you in Nigeria, but gold standard is taken to mean the best you can possibly do and the best care that can be provided. But we are recognizing that does leave large numbers of patients outside of treatment, like large numbers of patients without access to care. And certainly over here, we are talking about how that can lead to veterinary medicine becoming elitist and not very inclusive. So we are talking about contextualizing care such that you do the best you can for the patient in front of you, and you are prepared to flex where you need to flex in order to achieve a positive outcome. You show up, you do the best you can for the patient in front of you, and you act with intent to do good at all times. And for me, that is the foundation of veterinary practice. There was a time 25 years ago or so when I graduated when the vet was the source of all knowledge, and clients took their knowledge from the vet that they went to see. If they needed to know something about their patient, they could only get that information in any sort of meaningful sense from the vet that they were visiting. That is no longer the case, and clients now frequently show up with a whole raft of information that they've been able to get off the internet. In many cases, they have a very high level of motivation to research that subject in very fine detail, and will often come and even maybe teach you things. The job of the vet now, and the job of the vet certainly in future, is going to be able to is applying that knowledge in a way that works in the circumstances. That is what is going to set vets aside from the likes of ChatGPT, other AI systems, Google, any of these other sources of information. They can only provide you with information. They can't apply that information. And the role of the vet is very much going to be delivering that, breaking it down, and using that information more so than just providing it. And it is going to be vital that we can do this. Show up, act with intent, and do some good. And last night I touched on the case that I think I brought up about the young chap that was operating on this goat. And for me, this is it's not the ideal circumstances. But for the sake of a drape, what else would he do? I mean, he could leave the goat in difficult situation. He could kill the goat, but ultimately, for the sake of a drape, he managed to save 2 lives and achieve a good outcome. And when you look at in the UK how a similar procedure would be carried out thousands of times in each lambing season, right across the country, things are not that different in terms of the circumstances. You know, he had gloves on, which many of our practitioners would not need or would not use. And aside from that, the circumstances are not desperately different from the circumstances that chap was facing. So that is the epitome of what I'm saying. We just turn up and act with intent to do a good job wherever you are. That is the foundation of clinical excellence, and it is what clinical excellence is built on. I think in the longer term, it is what builds specialist medicine. It is what brings in new facilities. It is steps in the right direction. My son, this is a slight tangent, but my son, when he was younger, he used to get very frustrated because he could not ride his bike as fast as some of the other kids. And to save him his motivation, I said, look, remember, you're going faster than somebody who sat on the sofa. And in saving his motivation, it meant that he rode his bike. And in riding his bike, guess what? He got faster, which would not have happened had he not, if he had been put off, or if his motivation had been depleted by maybe not being quite in the perfect circumstances. And there's another phrase, perfection is the enemy of good enough. And I know we're here to talk about clinical excellence, but we have to take steps in that direction. And it's very easy to be dissuaded when you feel like you can't do something perfectly, when in fact, actually you can still do something very well in the position that you're in. I don't know if anybody plays football, and my time in Ghana, I am familiar with football being a very popular pastime in Africa. There is a phrase, a footballing phrase, which is play the ball where it lands. And the circumstances you are in is where the ball lands. And in football, we don't stop playing because the ball isn't where we want it. We play the game and we play the ball where it lands. And there were challenges faced by Nigerian vets, and we spoke about some of those yesterday. But for me, the big challenge, I think, is despondency when the circumstances are not right, and when you feel that you can't do your job in the way that you would like to do it, or you don't have the drugs or the facilities in the way that you would wish, that you become despondent, and it limits your dream, and it limits your future, and it narrows your vision. And that despondency becomes a challenge in itself. It becomes a hill to climb that we need to fight. That hill is created by our own thoughts in many ways. So no matter how small your feet or how short your legs, constant steps towards improvement and things will improve. And the converse to that is you can have the longest legs in the world, but if you don't start walking, you are never going to get there. So if we can keep the mindset that we do what we can, then, and we, in whatever circumstances we are in, we do the best that is available to us, then we can achieve and things will get better. To illustrate that point, can somebody just speak up just so I know that you can hear me?
Yes, I can hear you.
You can hear me. Sorry, I can't see people's faces, and for a moment to illustrate this point, there's a couple of case examples. This is an old Labrador, 13 years old, had a he presented as just being unsettled, panty, and just didn't appear to be comfortable. He, on examination, he had some evidence of being a bit arthritic, as you might imagine from an older retriever. But there was significantly a relatively large abdominal mass in his cranial abdomen. In a dog of that age, you might be starting to think of maybe a growth or a mass in his spleen or in his liver. His heart rate was normal. He didn't have any evidence of ascites or blood loss into his abdomen. Pulses were normal. His capillary refill time was normal. But he was a bit uncomfortable about this mass in the front of his stomach. And the client had little enthusiasm for doing anything further. He was an older boy, and further investigations would have proven costly. We would have been talking about ultrasound, maybe some biopsies, maybe radiography, ultimately removing the mass if we were going to be doing anything with it. And she had little enthusiasm to take those further steps. So what did we do? We put him on some pain relief. We explained gave her an answer and explained what I felt the problem was. We advised her on the likely development of that condition, and could encourage her to think about what to do in an emergency. We provided an avenue for advice, and we represented the profession, and we supported her and her dog through those latter stages without any recourse to anything particularly invasive, without any recourse to anything particularly expensive. We still showed up and did a job which was necessary, and we kept him comfortable. And I think that is the position that we are in. Even if we cannot, and the client does not have the will to take things further, there is still a large amount that we can do, which is still very positive and doesn't actually cost an awful lot or require very much equipment. It is the basics of what it means to be a vet, is to provide that support. And this is another phrase that I use quite frequently. A plan without a diagnosis is better than a diagnosis without a plan. Clearly, it is very good, it is nice, it is fabulous to have both. But if I had to have one and not the other, I'd rather have the plan, because with a plan, there is often a lot you can do. You can have a diagnosis and be no further. So there is still a lot you can do with a plan in terms of getting a good outcome for the patient. Many patients will get better with very little more than support, and we can still provide support. We can still provide food. We can still nurse them. We can still make sure they're taking fluids. We can still, we can provide antibiotics. We can provide analgesia. We can make them comfortable. There is still a lot can happen, even in limited circumstances. As a second example, I would talk about this Labrador, maybe not this Labrador, but a Labrador who looked similar. She was a final 5-year-old Labrador who presented on a Saturday morning. It was a very tragic situation. A young family had been walking their dog, and a speeding car had hit all of them on the side of the road. Now, one member of the family had been killed in the accident, and their dog presented shortly afterwards at the practice with in a lot of distress, and in the course of the examination was paraplegic, and you could feel the spinal fracture just running your fingers down the dog's spine. There wasn't an awful lot we could do for her, but we could do something for the clients. Again, we provided pain relief. We made a prompt diagnosis. We created a calm environment where the family could take time to consider what the decision was. It was obviously a very stressful time for the family, so we could counsel them through that. We could help owners make sense of what was a very shocking turn of events, and we could resolve what was a very distressing situation calmly and professionally, with the welfare of the patient in our first and foremost. Nothing particularly technologically advanced, nothing particularly expensive as far as facilities or drugs were concerned, but showing up, doing the best you can, and acting with the intent to do some good. Again, reiterating what I think is the epitome of what we do, and hopefully to give people hope and encouragement and motivation, such that if they are not lucky enough to be working in facilities that allow too much, that you can still recognize your input and recognize and claim your value in these circumstances. There is a feeling that you might say to yourself, the gremlins in the back of your head might feel that you are not really doing very much. But if we recognize the input, our impact on clients and patients, even in meager circumstances, it is possible to see an awful lot of good in what we are doing. And if all you can offer is a bed and some food, then give them a bed and some food. That is still a benefit and a positive outcome for many, many patients. So for me, the epitome of clinical excellence is this mindset. And that can be delivered in whatever environment you are working in. And it can be delivered even with relatively limited access to facilities. It also takes you beyond the clinic. So rather than, we may not be able to treat the puppy with parvovirus, but we can vaccinate many, many puppies and ultimately have a much greater impact than we will ever do treating individuals. We can take that excellence mindset in making advances in securing our drug supply and bringing in equipment such as radiography equipment and taking those little steps on short legs towards something better in future. And as I said yesterday, I think some of the most rewarding parts of a career is where we have an impact in that sense, because you see the greater picture and have a much wider impact than maybe would do in a smaller and more individual sense. So I'm happy to take any questions if people have questions.
Thank you so much, sir, for yet another wonderful session. I was able to glean so much again today, and I now understand better that at least the barest minimum I can do, especially when presented with a clinical case, is to show up. And we do have some questions for you and for Professor Adetola Ajadi. I'll start with, I have about 2 questions for you. This first question says, as a student, how will I be able to implement all the theoretical knowledge together to make a diagnosis without losing my license?
More difficult than you might think. As long as you stick to basic principles and don't overstep and overreach, and you have a good mentor for support and you look for help where it is needed. Certainly over here, you would be unlucky to be in a position where you would lose your license. With support and facilities and the network of people around you to help and hold your hand through the early stages of practice, then I think that would be a difficult position to get yourself into. I'm not aware of the legislative situation in Nigeria, but I think it is a fear that a lot of graduates have, and I think sometimes it is a fear that is excessive.
All right, sir. Thank you for that.
Hopefully that was a good answer. I didn't. Hopefully that was a reasonable answer. There's a lot to learn. But
yes,
lean on the people around you.
Lean on the people around you.
All right, sir. Thank you so much for that. I have another question for you. Now, this question says, What can I do differently to ensure improvement of clinical diagnostics in veterinary medicine? I'll take it again. What can I do differently to ensure improvement of clinical diagnosis in veterinary medicine?
So that one is quite easy. The easiest diagnosis, the best diagnostics, and the easiest diagnostics are ones that you are able to do yourself with basic facilities such as a microscope and in clinic practice. So taking swabs, scrapings, cytology, you can improve yourself in that sense very, very easily, and that will result in an immediate improvement in your diagnostics that are available. You can take blood and maybe do a PCV, and with relatively limited facilities have a good baseline diagnostic capacity.
Thank you so much, sir, for that. We appreciate the answers, sir. Now I have questions for Professor Adetola Adadi. Sir, are you here?
Yes, I'm around.
Okay, sir. So the first question goes, I'll read the first question now. How can you manage studies and business as well as leadership? How can one build a good foundation in leadership? These days we have a lot of veterinarians as well as students delve into other disciplines such as leadership and the like. So this question, I believe, is crucial that it is answered. So it says, how can you manage studies and business as well as leadership? And how can one build a good foundation in leadership, especially as it regards veterinary medicine and other disciplines?
Well, this is one that I put to my students all the time. One, you need to prioritize your desire. And the second thing also is that you need to know your resources. What resources do you have? If you don't have the resources to combine, and when I say resources, I'm not only talking about money or financial resources, I'm also talking about the emotional resources. There are some of us that we cannot manage too many things at the same time. Don't copy those people that can manage so many things at the same time. There are some of us that we do not have that intellectual resources to manage so many things at the same time. So first of all, discover yourself, know who you are. And once you know who you are, you discover the resources that you have. Then the next thing you want to ask is to prioritize. First, you are a student, so prioritize first of all your academic, then every other thing can come under that. Yes, if you want to do business, it's good to do business. You can, as long as you can manage it with your academics, it's not going to disturb academics, you can do that. If you want to go into leadership, yes, you can, as long as you know you have resources that can carry you through. I have people that have done that and done that successfully, but not every one of us can do that. So first, identify your resources. What resources do you have? And then prioritize yourself in these key areas. Thank you.
Thank you so much, sir, for that wonderful answer. I have one more question for you. So this question goes, when is the right time to start up your own practice as a fresh vet from school?
Well, the counsel is that as a fresh graduate, start a practice immediately. If during your student days, you are taking time to study or to join a good practice where you have learned a lot. If you have not done that, realize that 1 or 2 years Either you will volunteer,
Either you will volunteer or you will work
an established
and
practice
establish practice
before you start
before
yours.
you start
So
yours.
many things
So
that
many
practice
things
require,
that practice require,
which is not
which
taught.
is not taught in school.
Those things you are going
Those
to
things
learn it
you are going to
in
learn it in class.
So it depends. Like I said, it depends. One, if you, while you are a student, you have been volunteering and you have gained considerable experience, then you can start immediately. But if you have not, I think the best counsel I will give to you is to volunteer in one or two places that you know they have the kind of practice you would like to engage in. And then after that, you can then set out your own practice.
Thank you, sir, for that wonderful answer. Oh, sincerely, there are several questions that I would want you and Dr. Mark Holmes to give answers to, but for the constraint of time. But you said so much already, and we're deeply grateful for honoring the invitation and for delivering so much. We have been able to learn a lot personally, and I know several others who are present here. We've gleaned so much. So I would like to also thank Dr. Kunle for gracing us with his presence today. Thank you so much, sir, for coming. Thank you so much, Dr. Mark Ibikunle, for coming as well. And for everyone who is present here, we appreciate your presence here. Thank you so much for coming. It's a pleasure to have you here. We don't take this for granted at all. And thank you, Owners and Builders Club, in partnership with the Nigerian Association of Veterinary Medical Students, for organizing this great meeting. Thank you so much for that. Before we leave, I would like the host of this meeting, Dr. Akinlabi Ebenezer, to say one or two things to us. You're welcome, sir.
Yeah, thank you very much, Peace. You've been such a wonderful host. And thank you so much, Dr. Kunle Abiade. We are so grateful for you yesterday, Professor Adetola Ajadi, Mark Holmes, and Dr. Kunle as well. I'm so grateful, sir, for you showing up today. Yes, so it's an amazing opportunity to see this program come to this end today. And I mean, there's one interesting question here that has been quite under the radar. We'll just kind of read it out quickly. We just have 2 minutes to go. It says, what strategies have you found most effective in managing clients' expectation and building trust? And how do these contribute to clinical excellence? So my own experience was I did my first dog castration about 10 years ago, and it messed up. And the man was so disappointed in me. I think I was super disappointed in myself. And I never touched any dog scrotum since that time. So I think it's something you get where you're not sure what the way you're going to be perceived. So I'm going to talk. I think we all have on this panel senior colleagues who are minimum 20 years in the business. How have you maintained that professional and, shall I say, respectable reputation in front of your clients? And I would like maybe one of our speakers to just give us one or two strategies that has helped. I would like something from Dr. Mark Holmes, something from Professor Ajadi, something from Dr. Kunle Abiade as well. I know you're very busy, sir. If you can give us something that would be lovely, can just steal from you today, and something from Dr. Kunle Mark. And that will roll us a little bit more than the time, but we just ask for forgiveness. It's Nigerian time.
Listen to the clients more than talk at them. I think there is a phrase that says you've got 2 ears and 1 mouth. Use them in that ratio. So listen to the clients and communicate well.
Yeah, thank you. Listen to the client. Professor Adetola, please.
Yes. I think one of the things the clients wants to see is you demonstrating empathy and showing care for the patients. As long as you do that, the outcome to an extent does not matter to them. So, in whatever you are doing, please show empathy.
Sure.
Not about money. And number 2, make sure that you do your best, like Mark Holmes said. Do your best. And while you're trying to do your best also, try as much as possible to carry the clients along. As long as the clients can see what you are doing is carried along, no matter the outcome. The clients will have very strong respect for you.
Lovely. Dr. Kule, I know you are more in the farm business, so give us your perspective, sir.
Yes, thank you very much. I'd like to add that client education is very key. Like Professor Ajodi said, you educate your clients, you carry them along every step of the way, and you are good to go. Thank you.
Thank you very much.
Thank you very much.
Dr. Kunle Abiade, please, just 2 cents from you.
I mean, basically, everybody has said, but you know, client communication is so important. You know, there is nobody that has not had one challenge or the other, either through surgery or even medical service. But the most important thing is that for the client to know that in whatever situation it is, you have done your best. And if he feels that yes, you are communicating with the client at all times. When you're supposed to do it, give a prognosis, you have given it. When you have to tell the challenge that it's in front of you, you say it. So client communication is what every vet must have a grip of. And once you can do that, no matter the situation, you will surely understand that you have done your best. Thank you.
Thank you very much. I think this is where we draw the big curtain of this amazing conference. We look forward to do something like this sometime soon. And we're so happy for this huge attendance. I think we had up to 96 people coming today, which is really lovely. And looking forward to seeing you guys again. Thank you very much to all our friends and colleagues everywhere in Nigeria. Bye-bye.